Do you have a torn meniscus? Do you have pain in your knee? Today is the day I'm going to show you simple at-home tests that you can do to check if you have a meniscus tear. First exercise, do you have a meniscus tear at home? So, joint tenderness. Now, this is a simple test. It looks simple because it is, because if you have a tear, you'll know why. So, the simple test is, whichever knee is sore, you want to go to the lateral side, which is the outside of your knee. You want to get to sort of where on the bottom part, if you can see here, you want to go to just below the knee, move to the side, feel sort of the fatty part of the muscle and the tendon, and then you want to grab your thumb and press into that joint. Now, if you're pressing hard and you're not feeling any pain, you don't have a meniscus tear. But usually when you do, just by touching the inside of, or the outside of the knee and there is pain, that's usually the first key indicator that there is some sort of a tear in there. Again, you want to move, I'll do this on the other leg. You want to go into the medial side as well. So you do want to go into the inside of the knee. So again, from just below the cap outside, but also on the inside. Grab your thumb and press into the knee. You're feeling pain, generally that's a positive sign for a meniscus tear, and then you'll need to go get that checked. Number 2 on the list is lack of full extension. So bring your knee up like this on a bench. Simple test is really to know if you have a tear or not, is to see if you can straighten your leg. If you can't straighten your leg and you end up just going to that level and you can't lock, generally that's a positive sign for a meniscus tear. It's usually the first thing that most physicians do, but that would be the first test. So if I can't straighten and I get to that sort of 3/4 of the way and it feels like it can't go anymore, generally that there's a tear there and you will feel pain. Number 3, it's called a McMurray test. This usually has to be done obviously with the patient, with the person. So because you need to be sort of contorting the knee to a certain angle, but because it's on my own, I'll do it in a way that you can do it if you don't have anyone else to apply the pressure. So lay down on your back, leg down, grab a band to assist you with this because you will need someone, instead of having someone to push the knee, you'll need to against the band to push yourself. You're going to wrap it around the knee joint. With your leg, you're going to turn your ankle inward, as you can see, so straight inward, pulling the band that way in the direction, and then trying to straighten your leg like that. Now, if you're feeling pain, generally you will have a meniscus tear if this is painful. Usually the band is mimicking someone pressing their hand into your knee and you turning your feet so it hits the outside of the knee, But this band is just mimicking that pressure. So straighten the leg, and if you're feeling any pain, generally that's a positive sign for a meniscus tear, and then you'll need to go to see your therapist, PT, whoever you see, to get that checked more. So similar to the full extension, but you just want to mimic someone pressing into the kneecap or into the knee joint or just on the outside of the knee, contorting your ankle so it hits the outside of the knee, and then trying to straighten the leg. And if you're feeling any pain, generally that's a positive sign for a tear. Okay, the 4th test is a Apley's test. So this is similar to number 3, but now instead of laying back on the bench, you're laying on your stomach on the bench. So getting someone to put pressure onto your foot from a downward, from top position to down. Again, this will mimic that pressure if you are alone and don't have anyone around you to help you with the pressure. So again, around your foot, lay on your belly like this. Now you're just going to grab the band. I'm just going to try and do this on my own. So bear with me. And then what you're going to do is, it's a little bit of a calf stretch, but also you're going to mimic pressing down. So what I like to do, if you are alone, press your knee into the bench. So not so much pushing your leg forward, it's your knee down into the bench. That's going to mimic someone's hand on top of your knee. Now, if you're feeling the pressure, that's generally going to determine a positive sign of a meniscus tear. Now, the next level 2 version of this is to turn your foot out to get the lateral side of the knee on the outside of the knee, pressing your knee into the bench. And if you're feeling any pain in your knee, that will generally be a positive sign of a meniscus tear. Now, if you do want to find someone around you to do them, you can, but that's just simple ways that you can see to know if you have a meniscus tear. Go easy on yourself, do them very slowly, and then if you do have any pain, please refer on, find a PT, find your therapist, get onto a program, and you should be feeling better. Number 5 on the list, disco. Let's go to the disco. So this one now is just to mimic the movement through the knee, through that meniscus area, to see if you are feeling painful. Now, usually I would get someone to stand in front of me, hold their hands, and I can turn and pivot. There's no one here, so we can grab the stick. Now, hold one, come up onto one leg, and then with the knee, you're going to try and twist like so. So you're going to twist your knee out, twist your knee in, twist your knee out, twist your knee in. If you feel pain, chances are there'll be a positive sign for a meniscus tear. Turn, so foot on the ground, turn, 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 turn. So you're just turning through the knee joint. Now you feel the pain that way, feel the pain this way. Whichever pain you're feeling, if there is pain, generally that's a sign, a positive sign that you do have a meniscus tear. Those were my 5 at-home tests to check if you have a meniscus tear. Now, disclaimer, I am not a doctor, so these are just my gym at-home tests just to check if you have a meniscus tear. Please refer on to your GP, to your physician, physical therapist, no matter whoever you're seeing, or a PT, whoever you're seeing, go in and get checked. But these are just my at-home tests that you can do yourself to check to see how bad your tear really is. And if you love that video, you know the drill. Hit that like, hit that subscribe, and share the love.